My name is Dr. Olya Zahrebelny. I'm a general dental practitioner in the Chicago area. I have been in practice since 1978, after which time, when I graduated from dental school, I did a residency program in oral medicine, surgery, and pathology. I'm a comprehensive general dentist, and how I got involved with the medical billing was as a result of my experience after moving from Canada to the U.S., being on hospital attending staff at 2 hospitals. And it opened my eyes to the fact that so many procedures that are done in the mouth, oral and dental procedures, are covered by medical insurance and covered very, very well. But patients and doctors are not aware of this. So as a result of my experience as an attending physician and also as a consultant to insurance companies and learning the ins and outs of what goes on behind the scenes, I was able to formulate programs not only for implementation of the medical billing in my own practice, but also to teach other offices, both general and specialty practices, as to how to go about billing patient medical plans legally and without getting into any hot water with the insurance companies. My presentation today is titled Billing Patient Medical Plans, Nothing Illegal About It. So let's get started and see what situations and what scenarios are billable to medical plans. First of all, imagine the situation where a patient presents to the emergency room with facial swelling. An orthopanogram is taken, which is a panorex, and it reveals a large maxillary periapical abscess. The emergency room physician or oral surgeon performs an incision and drainage, inserts a Penrose drain, and then sends the patients on their way with antibiotics and with instructions to follow up with their general dentist. Do you think that the doctor in the hospital, as well as the hospital itself, will bill the dental plan? The second situation is a patient presenting to a physician with a raised firm lesion on the lip. After the lesion is excised and sent to pathology for review and for a determination of the diagnosis of a fibroma is made. Do you think that the physician's office is going to bill the dental plan? And then there's this situation where a patient presents to the emergency room once again with an impacted wisdom tooth or teeth with pericoronitis, lymph node swelling, and limited jaw opening. In the emergency room, an exam and x-rays are completed, typically, again, an orthopanogram, and the patient is prescribed antibiotics for the swelling and appropriate meds, then referred to an oral surgeon for the removal of the wisdom teeth. Do you think that the emergency room and the oral surgeon seeing the patient in the emergency room will bill the dental plan? So you have to ask yourself, why is our office billing these medical procedures to dental plans? Is it because you think it is illegal for a dentist to do so? Is it because you have received EOBs, explanation of benefits, from medical plans that state medically unnecessary treatment? Or do you think it's because that the only dentists that can bill legally to medical plans are oral surgeons? Guess what? None of these statements is true. It is absolutely on the up and up and legal for any dentist to bill medical plans. You just have to play by the rules. And most dentists, for some reason, think that dental insurance is for dentists to bill and medical insurance is for physicians to bill. And that is not true. It doesn't require anything shady on the part of the dentist, nor does it require any questionable moves or fraudulent billing. Dentists absolutely, and all dentists can do this. They can legally bill medical plans provided they are trained and licensed to do the procedures that are being billed, that they are coding exactly what has been done and there's no creative billing taking place, and they do not hide their degrees. Currently, everyone already does that when billing dental plans, right? So let's get started. Why should you access medical benefits in your dental practice? Well, first of all, because benefits are available for both oral and dental procedures. Oral procedures are procedures on the soft tissues, the mucosa, the bone. Dental procedures are procedures that are on or in the tooth. Secondly, more insurance dollars for which the patient is already paying premiums but enjoying the benefits can be accessed for necessary treatment. So you can access both dental and medical insurance plans and benefits for the patient treatment. There's absolutely nothing illegal about it. And thirdly, we all know that patients often decline necessary treatment because of the out-of-pocket expense. Also, did you know that the Delta insurance plans, the dental plans, now require a medical denial before paying for surgery, for pathology, and for appliances? And certainly, the trend I'm seeing is that other dental plans are now following their lead, including the Blues, the Blue Cross Blue Shield plans, Aetna, and many, many others. Why is that? Because currently there are medical benefits for all of these procedures and many more. And this is why the dental plans are saying we're only going to cover things that are covered by dental insurance that are not covered by medical plans. So let me show you proof of medical reimbursement for many, many oral procedures that you're currently performing in your practice. The first example is for an exam, an orthopanogram, the extraction of impacted teeth, 4 impacted teeth, IV sedation, and therapeutic injection. And you can see that the payment paid to the provider in this particular situation out of $2,825 was $721.80. There was a deductible payment and copay responsibility for the patient. However, keep in mind also that the copayment was a secondary insurance plan that the patient had and picked up the difference. So in essence, the total amount of $28.25 was paid by 2 insurance plans, both medical plans. The second example is for a simple CT scan that is being done for maxillofacial imaging. In this case, submitted charge was $650, and the payment made was $520. An 80% coverage according to the patient's plan. Benefits under the medical plan vary as far as payments go, anywhere from 70 to 100% payment, depending on the type of plan the patient has. In the next example, you can see a CT scan and interpretation being billed for a total of $850 and 85% benefit coverage for a total payment of $720. The third example shows a diagnostic stent together with the CT scan and interpretation, $1,500 being billed and $1,425 being paid. And again, these are routine payments that are made on a regular basis. This particular one is from Cigna. And I'm showing you examples from different insurance companies so that you're able to see that no matter who you're billing, the results and the payments are the same. Because no matter what state you're in, you will not be billing exclusively to insurance companies within your state. You will be billing to insurance companies in pretty much every state in the United States. The next example is for the extraction of 2 impacted teeth, general anesthesia associated with that, therapeutic injections, which are not local anesthesia. These are injections of things such as antibiotics, steroids, etc. And in this case, we see a billing of $27.35 and a payment of $27.10, with the patient's responsibility being only $25. In this case, excellent coverage by the patient, by the insurance company, and very minimal out-of-pocket for the patient. And you can see, obviously, the patient would be absolutely thrilled, not even being aware of the fact that they have coverage for this. The next example is for a CT scan interpretation and bone grafting. And in this case, we have a total charge of almost $8,000, $3,500 of that not being covered, and the provider receiving benefits in excess of $5,000 from the patient insurance company. 75% benefits for the diagnostics, 100% benefits for the usual and customary for the bone graft in the mandible, for a total of over $5,000. And the patient responsibility being the difference there, and a very minimal difference compared to what it would have been should they had to have paid all of it out of pocket. The next example is for the removal of 3 impacted teeth, the IV sedation, therapeutic drug injection. And again, you can see a billing of $19.75 for this. and a payment of $13.30. Again, excellent payment. Patient responsibility is only $90 because this was a participating provider in the plan. And that was, again, a medical plan. All of these examples are medical plans, not dental plans. Here we have an example from Anthem Blue Cross Blue Shield. This is for an interim prosthesis, which in dentistry we call a flipper, but that would not be a term that would be recognized by a medical healthcare professional. So an interim prosthesis for a total of $1,200 billed and $760 paid. And that was not a trauma case. The next example is for freeze-dried bone graft in 4 sites, ridge preservation. This was in conjunction with wisdom tooth extraction, a billing of $36.50 and a payment of $28.40. Again, excellent payment under the medical plan. The following example is for 2 implants or 2 fixtures being placed together with a maxillary bone graft and PRP. And we have a claim total of $7,085, benefit payable of $45.58. Again, there is a co-insurance, there is a co-payment. There is also no deductible notice in this situation because the patient had already met their deductible. For 3 implants being placed, this was billed again to Cigna. We see a payment of $6,110.40. And none of these examples, unless specifically I have stated on the slide, none of these examples are for trauma cases. They are for routine surgical procedures that are very necessary because of bone loss or bone atrophy. The next example is for endosteal implants being placed in the maxilla and mandible, together with sinus elevation, mandibular bone graft, and IV sedation. We have a total charge of over $20,000, a total net payment by this particular insurance company of over $11,000, patient responsibility of $3,427. Now you notice also that the eligible amount is different from the total charge because this particular dentist, who is a general dentist, was a participating provider, so there was what's called a network savings or a reduction in the benefits because of being an in-network provider to a medical plan. But regardless of that, the insurance payment out of that $20,400 was over $11,000, and the patient out of pocket was close to $3,500, rather than being the total $20,000 plus dollars. In the next example, this is for stage treatment where bilateral sinus bone grafts were done together with 4 fixtures being placed. And again, you can see here we have a billable amount of $16,554 to United Healthcare, and the payment was made at 100% benefit level for this patient. You will also notice on the EOB in the remarks section, it says this is a replacement check. Original check should be returned to the claim office. That is because the original check was for a lower dollar amount. They reprocessed the claim because an error was picked up, and according to the benefits payable, the patient had 100% benefits for these procedures. The next example is for a situation that dentists, for some reason, do not normally bill for, and that's for implant removal and bone grafting when there is a problem, infection, inflammation, or any type of failure. In this case, it was a $1,000 total charge, and you can see that the payment that was made was $720 with the patient balance of $280 for that. So there's absolutely no reason why dentists should absorb the cost. You know, anytime you are absorbing the cost or performing treatment at no charge to the patient, it is automatically an admission of liability that something was done incorrectly. And in that case, I would absolutely discourage you from doing that. Don't see physicians doing that ever. The next example is for implant removal. Sinus polyps, maxillary bone graft, PRP, IV sedation, and a therapeutic injection. And in this case, we see the total amount billed was $95.60, and the payable amount was $91.88, an excellent benefit payment with the patient responsible only for $372. In the next example, you see payment for 6 veneers. Again, this was not a situation involving trauma. This was a situation involving damage to the teeth as a result of medication that the patient had taken, a charge of over $12,000, a payment of close to $10,000 for this particular patient. The next example is also for veneers. Again, this is not a trauma case. Routine veneer placement, again for damage as a result of a side effect of a medication, therapeutically prescribed medication, not something that the patient was taking on their own as far as recreational drugs go. And the amount billed was $12,500, the payment $12,180, with the subscriber responsibility for the difference. Do you think those patients are not happy to see those kind of benefits, knowing that they didn't know to begin with that they even had medical benefits to pay for oral treatment? So are you convinced yet? Let's get started. What procedures performed in the dental office are medically billable? The first one is a procedure that most dentists are familiar with medical coverage being available for. However, they're not familiar with exactly how to bill traumatic injuries to the mouth. And again, whether dental or oral treatment is provided, medical coverage is available for all of these procedures that are associated with traumatic injury to the mouth. The second situation is for exams, whether they are exams for soft and hard tissue pathology, whether they are for exams and consults in preparation for surgery, or whether they are screening exams for oral or oral maxillofacial cancers. All exams are covered by medical insurance and medically billable. The third situation is for emergency treatment, a patient presenting for oral inflammation, oral infection, when there is, for instance, a periodontal abscess, when there is something caught in the gum like a piece of dental floss that creates an oral inflammation or infection. Those emergency situations are medically billable. The fourth situation is one involving stents, whether they are diagnostic, radiographic, or surgical stents. Each of them is billable. There are no restrictions on procedures. There's no restriction on the number of procedures that can be repeated. Unlike dental insurance, medical does not have those types of restrictions. The fifth category is for radiographs for diagnostic purposes, whether they be orthopanograms, jaw x-rays such as cephs, or lateral jaw x-rays, Waters views, occlusal films, CT scans. All of those are routinely covered under medical plans. The only limitation is with periapicals and full mouth x-rays. Because these are considered dental x-rays, they are only covered in cases of traumatic injury. The sixth category is biopsies, whether they be brush biopsies, smears for cytology, removal of part of a suspicious area for diagnostic evaluation, or excisions, removal of the whole lesion. All biopsies and excisions are covered benefits under medical plans. The seventh category is for the extraction of impacted teeth, any impacted teeth, whether they be wisdom teeth, supernumeraries, mesiodens, etc., as well as removal of ankylosed teeth. So extraction of any impacted teeth is a covered benefit under medical plans. The eighth situation is for surgical procedures that are not associated with traumatic injury. Any surgery that is necessary due to bone loss, bone atrophy, bone infection, pneumatization of the sinus are all covered benefits and medically billable. The ninth category is for prosthetics. Routinely, interim prostheses are covered in non-trauma situations because they are considered part of the surgical procedure and a healing prosthesis. So interim prostheses are routinely covered. However, when trauma is involved, not only is the interim prosthesis covered, but also the final prosthetics are covered as well. And the 10th and last category for procedures that are medically billable is involving appliances. Any removable or fixed appliances that are used to treat dysfunction, such as mandibular orthotics, NTI appliances, palatal expansion appliances, habit breaking, sleep apnea, snore guards, etc., are covered and medically billable. So, knowing that there are all of those procedures that are covered under medical plans, how can you access these medical plan benefits? First of all, you must speak the medical billing and coding language. You have to be familiar with the diagnosis codes, the ICD-9 codes. You have to be familiar with the CPT or procedure and treatment codes. And you must be comfortable with filling out the CMS 1500 medical claim form. Those are all things that you absolutely have to be familiar with and comfortable with. The ICD-9 codes are diagnosis codes that describe the medical condition or problem with which the patient presents. These are established by the World Health Organization. They are universal across the world. They go into effect on October 1st of each year, and they are in effect until December 31st of the following year. The CPT codes are procedure codes. These describe all diagnostic, therapeutic, medical, surgical, and other treatments. These are set by the American Medical Association. They are also updated on a yearly basis and include revisions, edits, additions, and deletions. So it is important to keep up with the codes and to familiarize yourself with the changes that occur on a yearly basis. If an obsolete or deleted code is used after December 31st, the claim will be rejected as not a covered benefit, even though benefits are available for the procedure, just the code has changed. So again, it is extremely important to keep up with the codes and be familiar with them as they come into use on a yearly basis. The CMS 1500 claim form is the only version of the claim form that can be used for submitting claims to medical plans. Dental claim forms are not acceptable, and any claims submitted on dental forms are automatically rejected. So if you've tried to do this in the past using a dental claim forms and you've gotten the results that treatment is not medically necessary, that does not mean the patient doesn't have coverage. It means simply you are not speaking the medical billing language. You can only use medical codes on this form, and the only dental codes that can be used are those for surgical extractions, removal of wisdom teeth in the D7210 to D7250 range. You can order the ICD-9 and CPT code books from the American Medical Association on their website by clicking on the bookstore and searching for the ICD-9 CM 2011 or the CPT 2011 professional editions. Alternatively, you can also order as well the CMS claim form. This is a medical claim form that is mandatory to be used. You cannot use one that's generated by your software. And for the most part, dental software, practice management software is not adequate for medical billing whatsoever. You have to submit on this original red form. You also have the option of, rather than buying the books from the AMA or Injectn or any of the publishers that publish the ICD-9 and CPT codes, you have the option of also purchasing what is called the Z book, which is published by the Z Group, which is my company. It is a manual that's revised, updated, and expanded every year. There have been many changes since 2010. Not only does it cover codes that are billable to medical plans, it also has narratives, letters of medical necessity, many claim examples, and billing and reimbursement tips that the AMA recommends to physicians that are billing medical plans. I thank you for your interest. I hope I've certainly sparked your interest in medical billing. It is an amazing opportunity for your patients to reduce their out-of-pocket expenses. It's also an amazing marketing tool for you internally with your patients, because you can bet on the fact that your patients, when they see the benefits that they're getting from medical insurance, will not only share that information with their family members, but also with their friends and coworkers. If you are interested in additional information or group and in-house programs and upcoming course information, or if you would like to purchase the Z book, please email me your questions to Dr. Z at thezgroupllc.com, and I will be happy to provide you with additional information and follow up to this program. Thank you so much.